Hi, I'm Cheryl Dalton-Norman with Conduit Health Partners, and I am so excited today to meet with Bre Loughlin, a nurse leader who is really, I believe, leading some really critical work in virtual nursing. And I'm just excited to hear from Bre today. Bre, welcome.
Hi, Cheryl. It's great to be here.
It's so good to have you. Bre, I would love it if you could just tell our listeners a little bit about you and also a little bit about Nurse Disrupted.
Yeah, I'd love to. So, hi, everyone. My name is Bre Loughlin, and I'm CEO and co-founder of Nurse Disrupted, which is a virtual nurse company that are the software and services for nurses to engage in real-time video encounters with patients at remote locations. Longtime nurse. I grew up in Seattle, became a tech nerd nurse for the first time in 2006, where I was recruited to my first startup, wound up consulting for big companies like Microsoft and T-Mobile, was brought to Sutter Health in Northern California when they were deploying this software system called Epic. And that's how I wound up in Madison, Wisconsin. I was invited to join the clinical informatics team at Epic in 2012. So I was a nurse executive at Epic, the EHR company, not the Fortnite company, for 8 years before starting Nurse Disrupted. Nurse
That's awesome.
Disrupted started off in homeless shelters and grew to the inpatient setting in 2022.
That's great. So when COVID hit and people really, those who were most marginalized were really having a hard time accessing care, that was really the impetus for you to start Nurse Disruptive, right?
Yeah, that's right. I mean, I wasn't sitting around, saying, what kind of business could I start? I was volunteering for Porchlight, which is an adult male shelter in Madison, Wisconsin. They have an incredible executive director, Carla Tennis, and we were talking about what was happening with the pandemic. If you've ever spent time in a homeless shelter, and I would absolutely recommend, people volunteering and really communing with that part of our community. But we were looking at what was happening. The science was evolving. If everyone remembers, like back in January and February of 2020, the CDC was trying to figure out what this virus was and how to screen for it. So, um, absolutely correct. Porchlight Adult Male Shelter had a utility trailer and a power outlet and a volunteer staff, and some of the access to clinicians that they had were shut down. So I always say they went from a little bit of healthcare access to none at all. And that's where I was talking to Carla, and I'm like, I know how to do something about this. Like, I know how to design the technology. And our first solution was up in 48 hours, which I'll never do again. I say.
That's
Really
amazing.
fast. Yeah.
Yeah, that is super fast, but
Yeah.
it's so great that you were responding to a need and answering that call. And so since then, you've really developed this virtual nursing capability and really have been a leader in driving thought leadership around why virtual nursing is important for health systems, for communities. And I'd love to hear from you, what do you think are the top three reasons that a health system or any other kind of healthcare organization should consider virtual nursing?
Yeah. I mean, something like 66% of nurse executives of acute care hospitals have virtual nursing in their strategic plan. And their number one why is nurse retention. So there are a lot of things happening, and there's always been a nursing shortage in my career. It got much worse in the pandemic, but we also have the silver tsunami coming. So there's a lot of competing pressures as to why hospitals need to give their nurses a reason to stay and to attract the nursing workforce to say, I pick your hospital to work because I have the opportunity to work in this innovative way. We also need to make more efficient our limited resources. So we have a global nursing shortage. You can't just, do international sponsorships anymore and fill the gaps. We really have to transform care delivery. And when you do, we really focus on those synchronous video encounters, and what you're able to do is make more efficient your limited workforce. So most nurses, if you say, hey, would you like a 4-hour shift from home, an extra one, 85% of those nurses will say, yes, I do. So already you're getting a little bit more just by offering nurses the opportunity to practice in the way that they want to. And then you're lifting that workload from your bedside nurses. The second fun thing that happens when you deploy virtual nursing is it's a recruiting tool. Nurses pick you. And then the third fun thing that happens is that we've had a huge loss of intellectual capital in nursing. So nurses, because of the physical wear and tear, will retire by the time they're 60 years old. And one of our first nurses at Nurse Disrupted, we don't do staffing, but one of the first nurses to use the platform, Jerry, she's gonna kill me. Let's just say she was in her upper 70s when she started, and she said that computers exploded when she touched them, and they don't. But we did design for people like Jerry to be able to return to the profession, that it could be a solution. So, getting that intellectual capital back for nursing at large is really important, and virtual nursing is a great path if it's designed correctly to bring our incredible experienced nurses back virtually to the bedside.
I love that. I love that. And you really kind of spoke to one of the barriers is sometimes the belief that if I touch a computer, it will blow up, or if I touch this, it's something not amazing is going to happen. Or we believe that people won't be receptive to it when we've seen evidence that they are receptive to it, even from a patient perspective. What do you see as a couple of the biggest barriers to virtual nursing, and how would you recommend those barriers be overcome?
Yeah. I think the first barrier is back in 2020, people were trying everything and not looking at the economics of it. There has to be return on investment. There has to be a financial play in this strategy. As nurse executives, we're doing this for that nurse retention, but you can't spend $20 million to make a buck.
Yeah.
And so one of the barriers to scaling, so everyone was trying something in 2020, 2021, and some people took too big of a bite and they went I call it dead on the wall. So people spent their budget for virtual nursing, didn't demonstrate the ROI, and didn't have the budget to scale. So you really need to right size your technology. And, Cheryl, you and I love talking about cash. I mean, this is why you're doing this podcast. We're talking about business and economics.
Yeah.
And that's a big piece of even outside of Nurse Disrupted, if people hear me speak at these different events and stuff, I do talk to nurse executives a lot about understanding the return on investment and the cash return for nursing innovation projects. So you can't do everything. Virtual nursing also is this big umbrella. People are calling, AI predictive models virtual nursing. People are calling sitting virtual nursing. And, part of the work that the American Nurses Association is doing, and I get to sit on the panel, I'm so proud of this work, is to taxonomize virtual nursing so that we can speak in a clearer language on what kind of care delivery is happening when we say virtual nursing, right? This is why I'm careful to say synchronous video encounters with nurses from a remote place to somebody, at a care site. So just you need a fast return on investment. It can't be the promise in 2 years from now, because that's the big hard lesson learned for early projects, is that they just spent $20 million. They're 2 years later, it took them longer to deploy than they thought it should. And they're not able to, really justify the expansion of the project. So be focused, be right-sized.
Yeah.
Most people, you're going to be doing admissions and discharges for the first couple of years. So, know that, and, be close with your CFO. CFOs can be
Yeah.
fun if you're working at the table with them. So I think that's another piece of the nurse executive CFO dyad can be one of the most powerful nursing innovation tools that a hospital can have.
Absolutely. No, I think that is really great advice, because sometimes we can get over our skis. We're going to solve everything and we're going to do everything. And then when we can't deliver that quickly, then it's like we're going to just stop. So how, as you're talking with CEOs, COOs, CFOs, CNOs in organizations, what advice would you give these executives for the future success of their organizations, how, and I think you've already spoken to this, but I'd love you to talk about it a little bit more. How would you position virtual nursing as a key to long-term success for an organization?
I'm writing this down. So the key to long term, there were a lot of things, Cheryl, that went through my mind as you were talking about this. When I sit at the table with the C-suite, I really think the hospital of the future is not wired. I think the word wired is old. This is like 80s, because as soon as you wire something into the wall, it's 2 years old and you have 2 years of life left. You know, Chat GPT had its big breakthrough 19 months ago, and now it has turned healthcare technology on its ear. And so what we must be is agile and fluid. You know, so if that answers, I mean, when I'm sitting down and talking to a hospital C-suite, I have a couple of questions. Like, one, what is the tech stack that you currently own and that you've invested in? We've got to look at that investment and learn how to be symbiotic with, you know, if you just bought Samsung smart TVs for 2 of your hospitals, the tech has to work together. We have to be fluid, and you can't have redundancy in the investments that you're making. But I also challenge things that have to be wired into a hospital's infrastructure. It's very expensive. And when we think of the pace of the acceleration of technology and its development, how can we together look at this strategy, not only to be symbiotic with your tech stack, but to look at the pace that you're going to be accelerating the technology that's in your patient rooms. So those are the two most common things, like as we're looking at the path to the hospital of the future, you know, that I see being so important. You know, be agile, really think if you're going to wire something down on the lifespan of that versus if you can create more of a fluid hospital environment.
I think that is amazing advice, because I think a lot of times we have an idea or a thought about how a service can be delivered, but we don't already look at in advance, what does this hospital, I think hospital have? What have they already invested in? How can you optimize that? And how can you prevent in the future spending money on things that will be outdated almost as quickly as they've been implemented.
Right.
So I think your advice is beautiful. I think it's right on. Bre, what other thoughts do you have? I just want to kind of close with an opportunity for, you know, if you have other thoughts, things I haven't asked you about, I would love for you to share those.
Well, that's a big ask.
I like to ask big
thoughts that we
questions.
haven't covered. The thoughts that you and I have not covered. I think if I were to boil something down in regards to virtual nursing, yes, it is better defining this large umbrella. The other thing that I think is a very important message is technology designed for nurses must be led by nurses. This cannot be for us without us. Virtual nursing, if you are looking at a solution, ask what nurse was at the table when that solution was being designed and developed, and where are they? Because the nurses at the bedside, we're innovators, we're powerful. If you start to hear something like my nurses won't, challenge that, because it's not correct. But I think that's the next piece of virtual nursing is here. You know, when you look at challenges in the news, like the protest in California for nurses who had an AI solution, nurses aren't afraid. They're not afraid of the AI. You have to ask yourself, what was the solution that was being deployed? You know, as a nurse, and not to stereotype us, but it's about patient safety and it's about your own safety. And we're actually really tech savvy. A lot of nurses, you know, I'm part of American Nursing Informatics Association. They are creating AI models. You know, it's CNIOs and their teams that are creating models. But I will assure you that if you are bringing any technology, virtual nursing or other, to the bedside these days, and you ask the question, where is the nurse on your team in designing this technology, and they struggle, then you should really think twice, because there are a lot of nurse-led companies out there designing solutions in an informed, ethical, and responsible way.
Oh, Bre, and for those listening, if you're not already aware, Bre is a nurse. I am a nurse. We are aligned on this. So I love that you're challenging us to say, where is the nurse in this whole cycle? And is a nurse collaborating and helping to lead the initiatives? I love that. I think that is beautiful. Well, Bre, thank you so much for spending time with me today. It's always a pleasure to be with you and to learn from you. And I look forward to talking with you more in the future.
It's so good to
Thank-
see you, Cheryl, and thanks for the opportunity.
Absolutely.